Hi, I'm Dr. Patrice Zahn, physical therapist and the owner of Group Hab Physical Therapy and Wellness. Today we're going to demonstrate some core exercises. We're going to begin with a base exercise called a crunch. So you'll need to find a nice firm surface. You can use a mat on the floor or you could use your bed with a mat on top of it. And you're going to get into this position, which we call hook line position. Now, to begin with, you're going to start working your core by doing a posterior pelvic tilt. You take your abdominal muscles and you're going to tuck your pelvis under. So I'm flattening my back towards the mat and I'm holding these abdominal muscles nice and tight. So I'm going to do that first, and now I'm going to do a crunch where I'm going to look straight up at the ceiling and I'm going to lift straight up, hold up for a count of 3, and then lower back down. And that is your base crunch. Most people, when they do a crunch, they do it incorrectly, where they are curling their head up like this. That actually can be hard on your spine. If you have osteoporosis, that can lead to compression fractures. So you want to actually come straight up, hold it up for a count of 3, and lower back down. You'll notice when you just lift your head up, you'll already begin to feel those abdominals engage. And you don't need to lift up very high, really just a couple of inches and holding it, and you'll feel those abdominals working. Now, to make that harder, you could actually put your hands above your head here. So now you have the weight of your arms. You're having to lift that up, and that can make it harder. Another way to make it harder is to add a straight leg raise. So you'll do your posterior pelvic tilt, hold it there, straighten your leg, and then now you're going to do the straight leg raise with the crunch, and then lower it back down. Now, by adding the straight leg raise, you're really pulling the abdominals because the weight of your leg wants to pull your pelvis into anterior tilt. You have to work hard to put it in posterior tilt, holding the abs tight. If you are doing this exercise and you feel like your back is starting to arch off of the mat, then you know this exercise is too difficult for you at this point, and you need to revert back to the base exercise of the crunch. As a rule of thumb, you want to shoot for 2 sets of 10 repetitions of this exercise. So I hope you enjoyed this video. Once again, I'm Patrice Zahn, owner of Group Hab Physical Therapy and Wellness. Join us for our next video.